Hello, nice to have you in today's edition of You and Your Health. Today's edition will be a little bit different because I look at the event of now and consider it necessary for us to have rather an interactive section. And we have a number of questions that have come so much and so many of them. Let's take this zero question I feel is quite striking. And he said, "Good evening, doctor. I won't say I am getting frustrated, but honestly, something like that. I have done everything humanly possible to get my weight down, but to no avail. I am already experiencing a heart problem you mentioned in your last week program. Please, I need help." All right, this is also an interesting thing right now, and this has to do with the issue of obesity. I don't know how big she is, and she is actually calling and saying, I have a problem, and that problem has to do with obesity. I've done everything humanly possible. He said, I'm not frustrated, but it's most like I am. Of course, when somebody is having an undesirable weight, obviously there will be something like depression. Unfortunately also, to most of them, sometimes they become aggressive because people around them will be speaking and say, no, this your weight is too much, this your weight is too much, you are eating too much. But to them, they know that they may not have been eating, as someone is actually pushing them and saying they are. A number of such situations exist, and I think I have one case of that I will equally show you here, which will enable you have an understanding. But permit me to also say this: if you are overweight or having the one they call morbid obesity, I mentioned last time that obesity is the mother of all diseases. Obese patient can trigger hypertension, trigger diabetes, trigger issue of heart-related problem. As a matter of fact, there are certain weight you will have that is not compatible with life. There's certain kind of weight you will have that is not compatible with life. Even yourself, to carry yourself and also for you to sleep, you find that it is a near-death experience in a number of occasions. Some of them will sleep and snore, and the snoring, you will know that it's either the person is in purgatory, just looking for somebody to push him small, he will fall to the other side. It happens. It's a practical experience, I'm just telling you. But I come to be of help as she actually, seeking for that right away. That help is, you don't need to get depressed. You don't need to get frustrated. Don't get angry when people talk to you concerning your weight. Don't get angry. Listen to me. Be nice enough to yourself to tell them, thank you, I'm working on it. All right? Because it is not just for ecstasy. It's not just because of you looking good. It's much more than looking good. As I earlier mentioned, heart problem can come in. The issue of sleeping apnea can come in. The issue that has to do with hypertension, diabetes, hypercholesterol, or hyperlipidemia, which can lead to heart attack and all that. I'm not threatening you with all those medical challenges, but it has been by issue of evaluation seen to be a contributing factor to most of these things we mentioned right now. And she is asking a question, what do I do? And here is where I give you the plan. Number one is that I will recommend a dietary management as the first line, and most importantly, with a dietitian. All right? And a dietitian will be able to you have a protocol that will enable you people see how far that will manage. And also, additionally, exercise is one key thing that also can drop your weight. Okay? Ultimately, when all the other treatment options fail, there remaineth one that can still be in position to reduce the weight to the normal, and most importantly, can help control diabetes, help to control blood sugar, help to control the issue of blood pressure, And that is what is called bariatric surgery. Bariatric surgery, you can have what is called sleeve gastrectomy. As a matter of fact, the most disturbing experience is that most of these obese people feel, I eat what other people eat. How come? Mine happen to be different. I will tell you what happened here. Look at this. This is the stomach, all right, that the food gets in here. And in a number of occasions, when the food gets in here, the digestive enzyme that get to digest the food as quickly as possible to get it happen in this other upper segment of, they call it the fundus of the stomach, this particular side. So in a number of occasions, the difference between where a slim person will eat 4 cups of garri and remain the same, and another fat person will eat even half and still getting fatter, is the same food they will eat, but when the one of obese, some of them, their digestive enzyme here digest every content or whatever goes in and store them and start spreading them into the adipose tissue called the fat cells and deposit them in different places. In addition to excessive digestion of the food, the brain that actually releases a stimulation for hunger center is also located here. So this very fellow may be feeling quite hungry and more voracious to eat more because of this particular section is hyperactive in most of those obese patients. So when you do what is called sleeve gastrectomy or bariatric surgery, it will just slice off this very place. It's done without tearing the body open laparoscopically. It can just slice off this very portion. By so doing, 2 things: it will not allow the person to be eating too much food, and he also not be in position to become too much hunger. All right, so you could be in position to live. By so doing, within 2 months, a person over 200 kg can lose as much as 50 kg. It happens and it gives that very excellent result. I think I have one interesting testimony here you will appreciate.
I am here to share my amazing experience to everyone. Formerly, I was weighing 230 kg, but now, as you can see, I am weighing at 90 kg. You might ask, how did she do it? Well, I was a diabetic patient, I was hypertensive, and I was also obese. But through the new advanced technology called laparoscopic sleeve gastrectomy, that made a difference.
She actually was 230 kg. 230 kg. But after the sleeve gastrectomy, this happened that she currently live her life 90. And as you can hear her, she's no longer, she used to be hypertensive, diabetic, but none of such happened now because excess fat in the body used to fuel most of those things. All right, so that is the advantage. What I'm saying here, that in a worst case scenario, it is very important through dieting, through exercise, be able to get your weight down, very healthy. However, in a worst case scenario that the weight is obvious, going towards morbid obesity, morbid meaning death, obesity with all manner of life-threatening complications, the best thing first is to start with what they call sleeve gastrectomy, which can give this kind of result. It is an amazing thing that happened in the world of the obese patient. Okay.